to China, where the hospital system's coming under an increasing strain as COVID spreads quickly again.
We have a new name for the coronavirus, COVID-19.
China is going through its worst outbreak of COVID-19 since the beginning of the pandemic.
It looks like China is in for a tough few months.
With a total of 1,325 deaths recorded.
COVID-19 created a nightmare, infecting millions of people and causing death and chaos everywhere. Health systems collapsed, resources vanished, the global economy was shaken, and hunger spread.
This pandemic has essentially taken all the inequity and all the broken systems in this country and set it on fire.
Schools were closed and
some have lost loved ones, others their jobs.
Mental health is not going good.
As the generation of youth faced an uncertain future that no one had ever imagined.
So it is devastating to healthcare systems, and also what's kind of interesting is that a lot of folks are looking at healthcare systems and saying, well, providers, this is an area where they're going to do well.
Misinformation started spreading, which caused confusion.
Message said that the coronavirus, when it falls on metal surfaces, it will survive for up to 12 hours.
As China dealt with the fallout of a broken healthcare system,
the hospital is just overwhelmed from top to bottom.
The real origins of the crisis remained hidden. Bats, especially horseshoe bats, have secretly carried a dangerous virus for years. They are the silent carriers of a deadly threat.
Live bats were in fact kept in cages inside the Wuhan Institute of Virology.
For a long time, the focus was on the Wuhan Institute of Virology, where scientists were studying bat viruses.
The group behind the discovery, Drastic, was formed on Twitter in 2020 and has set itself the mission of exploring the origins of SARS-CoV-2.
In December 2019, Dr. Li Wenliang, a humble ophthalmologist in Wuhan, was among the first to see the signs of something terrifying. A SARS-like virus quietly spreading in humans, and he knew how dangerous it was. Immediately, he reached out to colleagues, warning them, urging them to take precautions, but no one listened. Instead of being called a hero, Dr. Li was branded a criminal. Authorities accused him of spreading rumors, and he was forced to sign a false confession. The truth he fought to expose was silenced by the very system that should have protected him. Dr. Li Wenliang, who courageously warned the world about the virus, somehow caught it himself. In his final days, he shared his condition. But unfortunately, on 7th of Feb 2020, he tragically died of the virus. Months later, his wife gave birth to their child, a heartbreaking reminder of the life he never got to see. The US government, including the FBI and the Department of Energy, raised several questions. Why were such dangerous projects allowed to continue despite knowing biosafety risks? But perhaps the most curious question of all, why did China suppress information in the early days of the outbreak? And finally, one lingering uncomfortable question. Was the virus engineered or accidentally enhanced during experiments? A news article by Forbes stated that China's reported COVID's death rate might be understated by a factor of 17,000%, suggesting the true number of deaths could be around 1.7 million compared to the officially reported 4,636 at the time.
Satellite images show crowds at China's crematoriums and funeral homes as COVID cases explode across the country. The images, taken by Maxar in late December and early January and reviewed by CNN, show lines of cars waiting outside of funeral homes in 6 Chinese cities.
Fang Fang saw the truth when others chose to look away. In her book, Wuhan Diary, she exposed the government's failure to act in the earliest days of the outbreak. She wrote about the delays, the confusion, and the fear that gripped Wuhan.
China, where a rapid surge of COVID-19 infections is overwhelming hospitals across the country.
Instead of addressing the crisis, the government fed the public false narratives, pushing a message of strength that didn't reflect the reality on the ground. Fang Fang didn't stay silent. She spoke out, giving a voice to the ordinary people and the healthcare workers who were left to fight alone. But when her words reached the world, she was called a traitor. Yet, Fang Fang and Dr. Li wasn't betraying their country. They were simply telling the truth. And now as we look back, we must ask, how many lives could have been saved if the truth had been heard sooner?
Wu-Shang,